Hi viewers, welcome to Ellargu Namaskara. Welcome to my channel Healthy Topics. Myself Dr. Chandrasekhar, MD physician, diabetologist. So today we are going to discuss an important topic called GDM, that is diabetes in pregnancy. Previous part we have seen part 1, part 2, part 3 of various issues in diabetes. So straightly we go back to GDM, gestational diabetes. So GDM accounts for 4% in all pregnant women. Now due to increased screening in pregnancy and lifestyle in mothers have increased to 15% incidence of GDM. Okay. So coming to the why this GDM is important is ಏನಕ್ಕೆ ಇದು ಒಂದು diabetes in pregnancy ತುಂಬಾ important ಅಂದರೆ ಇಲ್ಲಿ diabetes does not only risk the mother, it also risk for the baby too. So coming straight back to the what are the risk for the mother. We'll go back to the first baby. Usually baby will have what is called large baby, that is macrosomia, and baby can present with neonatal diabetes. During delivery, since baby is large, this can go for what is called as large baby leads to shoulder dystocia, maternal laceration, that is genital laceration. These are the very important adverse effect in GDM for baby. Mother, they'll have high risk for preeclampsia, and future they can go for over diabetes. ಸೊ ಯಾವ ಥರ ಒಂದು ಪೇಷಂಟ್ಸ್ನ ಇವ್ರನ್ನ ಸ್ಕ್ರೀನ್ ಮಾಡಬೇಕು, ಡಯಾಬಿಟೀಸಲ್ಲಿ ಶುಗರ್ನ ಸ್ಕ್ರೀನ್ ಮಾಡಬೇಕಂದ್ರೆ ಎಲ್ಲ ಪ್ರೆಗ್ನೆಂಟ್ ವಿಮೆನ್, ನಾವು ರೀಸೆಂಟ್ ಗೈಡ್ಲೈನ್ಸ್ ಎಲ್ಲ ಪ್ರೆಗ್ನೆಂಟ್ ವಿಮೆನ್ ಶುಡ್ ಗೋ ಫಾರ್ ಸ್ಕ್ರೀನ್ ಅರೌಂಡ್ 24 to 28 weeks ಆಫ್ gestation, 24 to 28 weeks. Here you are going to do what is called oral glucose challenge. Here it is given 50 grams of glucose. You are going to check after 1 hour. If it is more than 130, you are going to go for GTT, glucose tolerance test. This glucose tolerance test, it is given again glucose around 75 to 100 grams of glucose. You are going to check fasting 1 hour, 2 hours, 3 hours. Fasting normal value less than 95, 1 hour less than 180, 2 hours less than 155, 3 hours less than 140. Any two values variation taken as GTD is positive. So you are going to go straight to the treatment for pregnant women. That is, your diet and exercise is most important in GDM. Apart from diet and exercise, if patient is not able to maintain the sugar value, you are going to go for medications. The drug of choice in GDM is insulin. Insulin have a very good safety data in pregnancy. This GDM also imposes problem for baby like congenital anomalies. So usually we are going to go for what is called pregnancy glycemic control. Andre ಒಂದು baby before planning for pregnancy, we are going to assess the glucose status of the mother. Why this is? If the baby exposes to hyperglycemia in early pregnancy, 5 to 8 weeks early, baby can have congenital anomaly and can go for spontaneous abortion. That's why we are going to give target of HbA1c in pre-pregnant state less than 6. So these are the important things in GDM. Coming to the complications for mother can have associated preeclampsia, they can go for diabetes. Coming to the insulin, usually the recommended insulin types is Lispro, Aspart and Dedimer. Glargine is totally contraindicated. However, drugs can be given, that is metformin and glyburide. However, randomized control trials and cohort studies have not shown 100% safety, since glyburide and metformin is secreted in breast milk. Then coming to the diet, we have explained the detail in the previous part. It comes same to the GDM mother with few variations. And exercise also, it is mild exercise, mainly the stretching exercise. Then coming to ಈ ಒಂದು diabetic in pregnancy, again we are going to screen after delivery. ಯಾವಾಗ ಸರ್ ಚೆಕ್ ಮಾಡಿಸೋದು ಅಂತ ಕೇಳಿದ್ರೆ, usually it is done around 4 to 12 weeks after the delivery, that is postpartum. Here you are going to perform a GTT. Again one more time, if it is normal, you are going to discontinue the medication and advise diet and exercise. This, as the pregnancy progresses, this insulin resistance will happen in the late pregnancy. That time patient or requires increased dose of insulin. Insulin dose is usually given around 0.8 to 1.2 units per kg per day. Andre one pregnant women of weight around 60 kg requires 60 into 1, that is around they require what 1.2 is around, it comes to 7 to 8 units of the insulin per day is required. So this is about the GDM. So we have discussed the GDM in depth, important points regarding GDM. So in future we are going to upload a few important shorts, YouTube shorts regarding diabetes on and off. Kindly watch those shorts, okay? And thank you for watching this video. Please kindly subscribe and share with your friends and family regarding the GDM and other related topics of the diabetes. Thank you. Namaskar.